Many Kenyans living with hematological conditions are in need of a lasting solution. Bone marrow transplant is said to be giving hope to these patients. My name is Beldin Waliaul, and on this week's episode of Health Watch, we look at how bone marrow transplant or stem cell transplant is also giving hope to cancer patients. There are various treatment options and technologies when it comes to treating cancer-related conditions, but one mode of treatment that is quickly gaining momentum when it comes to treating certain types of cancer, this is bone marrow transplant. A bone marrow transplant is a medical procedure that replaces your bone marrow with healthy cells. The replacement cells can either come from your own body or from a donor. Dr. Peter Shikuku is a hematology expert and a medical doctor at the Nairobi West Hospital.
Lately, we have tended to use a terminology we use hematopoietic stem cell transplantation. And the whole intention around bone marrow transplants is to go to the bone, figure out medically how to stimulate what comes or what is resident in the bone for utility as part of treatment. And I'll explain. So we know that the bone is, especially the marrow, is a factory, and it is a factory for the various cell types that we are all used to. Blood is a function of three types of cells. We have the red cells that gives blood its normal routine color. We have the white blood cells that takes care of our immunity, and then we have platelets that take care of our bleeding aspects. So the marrow has cells in it that we call stem cells. Stem cells are young cells. They, medically speaking, we say they are undifferentiated. They are still young to the extent that they have not decided what they will be. Okay, that's why they are called stem cells. And those cells are resident. They sit inside the marrow.
With the advanced technology, harvesting or getting stem cell from a donor isn't that invasive as it used to, despite it being a delicate procedure.
Now, for us to be able to harvest those cells, what do? Previously, and that's why it used to be called bone marrow transplant, someone would take a needle. You are taken to theater, and then you get numbed a bit, and someone goes into the marrow with that needle and aspirate the marrow. So you literally harvest, you suck out the marrow, and then you go and refine that marrow to get the stem cells. That technology is old technology, and it was, it had its own challenges. Lately, we use medications to stimulate the same marrow, to release those stem cells, to get out of the marrow so that it starts circulating in our normal blood vessels. Using technology, we can then take the blood into an equipment that spins that blood and creates layers. One of the layers are the stem cell layer. Then you have other cell layers, and these are split and separated based on density. So I can choose to remove the stem cell layer and take it into a bag. The rest of the cells plus any other fluid is taken back into the patient. So we have now technology lately that can be able to split this and remove the stem cells for us to use those stem cells for transplantation. Okay, that process is called apheresis. It's a process that we use to literally process these cells. We extract these cells and we can store them for transplantation. So that is how we get the stem cells from the marrow. We stimulate using drugs, then we harvest using a machine for subsequent storage and utility. That's why I said it's no longer, those aggressive processes that we used to apply before.
The transplant comes in different forms. Transplantation can be used to treat certain types of cancer, such as leukemia, myeloma, and lymphoma, and other blood and immune system diseases that affect the bone marrow.
That there are two different types of transplants. We have what we call autologous transplantation, but we also have what we call allogenic transplantation. Autologous transplantation is where an individual becomes their own donor of the stem cells. And I'll try to explain when you become your own donor. We have conditions where your body goes berserk, it goes mad, if we were to use such terminology, and your own personal cells that have matured decide to, go rogue, and they become cancerous. And in the process, start destroying what is normal. Now, in such scenarios, what do? We can harvest your stem cells, okay, which are still normal. Remember, it is the mature cells that are abnormal. Okay, I'll use a condition like multiple myeloma, where you get a cell called a plasma cell, which is a mature cell, becoming cancerous and causing harm to the body. We can stimulate the stem cell within the bone marrow, harvest that stem cell, destroy this abnormal cell, and reintroduce your own normal stem cells. So what have we done? We have used you as a donor to treat you as a recipient. So we call that autologous. But we also have scenarios or conditions where the cell that is cancerous has a change in it that you would have to destroy everything and get a fresh normal person to give you stem cells that are not cancerous. So we have scenarios of that kind. Should that happen where you are getting stem cells from someone else for you to benefit as a recipient, then we call that allogenic. Okay? And so the two are very different, because in one scenario, you have a patient becoming their own donor. But for the other scenario, you need another person to save the life of another individual. So the challenges will be a little different. Okay, and we can look at the pros and cons around each of those. But having said that, I remember you had asked me about the conditions that can actually benefit from bone marrow transplants. So let me look at it from this perspective, that we have conditions that are said to be cancerous that could benefit, but we also have conditions that are non-cancerous. You are born with a condition that can actually benefit from bone marrow transplantation. For example, let me start with the cancerous conditions. If you have cancer that involves your blood, you've heard of blood cancer. Medically, we call them leukemias. So leukemias would benefit from bone marrow transplants, where we literally destroy the entire marrow, including the cancerous cells, and we retransplant normal cells. We also have what we call lymphomas. Okay, we have multiple myeloma, among others that we can talk about. But when it comes to the non-cancerous arm, we have common conditions like sickle cell. We have other conditions where the marrow just misbehaves, doesn't produce anything. We call aplastic anemia. We have multiple sclerosis. Again, the list can continue. But having said that, as a country, what are we supposed to do? First of all, we need to make sure we have facilities that can be able to provide this form of care. The kind of care a bone marrow transplant patient requires is a little, sophisticated, in the sense that for you to be transplanted, you have to be put on medications that literally sterilize you. So you get sterilized as a person. We put you on drugs that literally wipes off your immunity. Okay, so you should be put in a very sterile environment where any form of infection should not be given a chance to get close to you. So such a facility is called a positive pressure facility. So we use positive pressure. So if we were to take an example of this room to be an ordinary room, if you open this door, chances are that if the pressure here is low, air will flow inwards. If pressure here is high and you open this door, air will flow outside. Now we want a scenario where the air here in this room is higher, at a higher pressure than the air outside. Why do we want to do that? So that anybody who comes from the outside does not allow infections to come inside. We want the air in here to blow away anything that you might be coming with. And that's how we safeguard the patient from external sources of infections.
Before the bone marrow transplant is undertaken, once matching donor is identified, then cells collected. The patient then undergoes pre-transplant treatment either through chemotherapy or radiotherapy. This prepares the body to receive new cells. The patient is then prepared for the main procedure of receiving donor cells, where they will inject blood stream through a catheter, and then one will start the recovery process through close monitoring.
If we were to look at bone marrow transplants as a country, and we looked at a disease like sickle cell, so first of all, sicklers will get stem cells from another individual because their cells are already abnormal. Okay, so they'll fall under the allogeneic group where someone else has to donate for another person. So what are we supposed to do? Before we get stem cells from this donor, we must match the two. Okay, so we call that HLA matching. You want to make sure the person who is giving you the stem cells is almost as close as possible to you who is receiving it. Because if we give you stem cells from anybody else that is not matched, what will happen is that your body, because now I'm giving you something from from an external environment, external to you as a person. So your own body will either fight whatever is coming in, okay? We call that graft versus, that is host versus the graft. So, if my immunity decides to fight what has come from outside, we call that the host, because I'm the host fighting the graft. But take a scenario where my body and its immunity has been taken down. Now the graft comes, and the graft is the stem cell. The stem cell can start fighting me. We call that graft versus host disease. So the graft now comes to start destroying me rather than being beneficial to me. Okay? So we want to prevent that as much as possible. For us to do that, we use immunosuppressive drugs. We must suppress the immunity. But we must, at a bare minimum, match the donor and the recipient. Bear in mind that when we are doing allogeneic transplants, we have to be extremely careful to the extent that by the time we are preparing you as a donor, we have matched you. So someone is going to give you stem cells. We have to make sure we take care of the donor just as much as we take care of the recipient. Because take a scenario where she's the recipient and you are the donor, and we start putting on drugs that will destroy her immunity, and in the process of you coming to the hospital to donate, you have an accident. What will happen? She now has nothing, and the donor is in trouble. Okay? Basically, we have killed this person even before we start the transplant process. So we take care of the two just as much.
Bone marrow or stem cell transplant restores one body's ability to create the red blood cells, white blood cells, and platelets it needs. Recovery from a bone marrow or stem cell transplant takes a long time. It has stages, starting with intensive medical monitoring after the initial transplant day. As the long term recovery journey progresses, the patient eventually transitions to a schedule of regular medical checkups for months and years.
And you have your transplant and you are ready to go on with the life. So there'll be complications to that effect. Of course, the bigger complication is when you start having, graft versus host rejection, and that complicates again the outcome of the transplant, and you have to be on these immunosuppressive drugs for whichever period of time. But thereafter, we usually say bone marrow transplants are a cure for the disease, because once it takes and you're okay, you should now be able to live, almost disease free for whatever amount of time, because you've now been normalized from a sickler to a normal individual. And that's why we say bone marrow transplants for sicklers is part of the cure that we would have wished we could see. There are other conditions, obviously, that is also a cure. Patients with lymphomas, aplastic anemias. So there are some conditions where the bone marrow transplant has good outcomes. But then we must have a conversation as a country and agree on who can benefit from a transplant, because it's about resources. It's not just, anybody wakes up and say, I need a transplant. No, we need to have a conversation on who can actually qualify for a transplant, who can't qualify for a transplant. And we design our own national protocols that enable us to make decisions as we move along as a country.
A successful transplant may mean different things to you as a patient. One is that your blood count will be back to safe levels while the cancer will be controlled. A cure may be possible for certain cancers, such as some types of leukemia and lymphoma. For other diseases, remission of the cancer is the best possible result. Bone marrow transplant is quite a costly procedure. Although bone marrow transplant isn't 100% cure, cancer patients who have undergone it at least will have their lives prolonged. Belden Waliaula KTN News.